will be good and well. I welcome all of you on my YouTube channel Post Ads, where you get all type of videos from all over the world, especially from USA, Canada, UK, and all the Europe. So, if you have did not subscribe my YouTube channel Post Ads, I request all of you to like and subscribe my YouTube channel Post Ads. Let's start our today video. Today we are going to talk about health insurance, especially in USA. So let's start our today video, which topic is health insurance and its definition and how it works. What is health insurance? Health insurance is a contract between a company and a consumer. The company agrees to pay all or some of the insured person's health care costs in return for payments of a monthly premium. The contract is usually a 1 year agreement during which the insurer will be responsible for paying specific expenses related to illness, injury, pregnancy, or preventative care. Health insurance agreements in the US generally come with exceptions to coverage, including a deductible that requires the consumer to pay certain healthcare costs out of pocket up to a maximum amount before the company coverage begins. Number two is one or more co-payments that require the consumer to pay a set share of the cost for specific service or procedures. Key takeaways: health insurance pays most medical and surgical expenses and preventive care costs incurred by the injured person in return for a monthly premium payment. Generally, the higher the monthly premium is, the lower the out-of-pocket costs are to the insured. So virtually all insurance plans have deductibles and co-pays, but these out-of-pocket expenses are now capped by federal law. Number two is since 2010, the Affordable Care Act has prohibited insurance companies from denying coverage to patients with pre-existing conditions and has allowed children to remain on their parents' insurance plan until they reach the age of 26. Medicare, Medicaid, and the Children's Health Insurance Program are federal health insurance plans that extend coverage to older, disabled, and low income people. How health insurance works? In the United States, health insurance is strictly to navigate. It is a business with a number of regional and national competitors whose coverage, pricing, and availability vary from state to state and even by country. About half of the population has health insurance coverage as an employment benefit, with premiums partially covered by the employer. The cost to the employer is a tax deductible to the payer, and the benefits to the employee are tax free, with certain exceptions for 5 corporation employees. Self employed people, freelancers, and gig workers can buy insurance directly on their own. The Affordable Care Act of 2010 2010, commonly called Obamacare, mandated the creation of a national database called Healthcare Government, which allows individuals to search for standard plan for private insurers that are available where they live. The costs of the coverage are subsidized for taxpayers whose incomes are between 100% and 400% of the federal poverty threshold. Some but not all states created their own versions of healthcare.gov that are tailored to their residents. People over the age of 65 and those with disabilities and stage renal disease or ALS qualify to receive federally subsidized care through Medicare, while families whose incomes are near the poverty level are eligible for subsidized Medicaid coverage, types of health insurance. Health insurance can be tricky to navigate in the US. So-called managed care insurance plans require policyholders to get their care from a network of designated healthcare providers. If patients seek care outside the network, they must pay a higher percentage of the cost. The insurer may even refuse payment outright of services obtained out of work. Many managed care plans, for example, health maintenance organization and point of service plans, require patient to choose a primary care physician who oversees the patient's care, makes recommendations about treatment, and provides referrals for medical specialists. Preferred provider organizations by contract don't require referrals but do set lower rates for using in-network practitioners and services. Insurance companies may deny coverage for certain services that were obtained without pre-authorization. They may refuse payment for name brand drugs if a generic version or compatible medication is available at a lower cost. All these rules should be stated in the material provided by the insurance company. It is worth checking with the company directly before incurring a major expense. What are co-pays, deductibles, and co-insurance? Most health insurance plans require their customers to pick up some of the costs of their coverage in various ways. The deductible is the amount that the customer must pay out of pocket every year before the insurer begins to meet the costs. This is now capped by federal law. Co-pays are set fees that subscribers must pay for specific services such as the doctor visits and prescription drugs even after the deductible is met. Co-insurance is the percentage of healthcare costs that the insured must pay even after they are met the deductible, but only until they reach the out-of-pocket maximum for the year. Insurance plans with the higher out-of-pocket costs generally have smaller monthly premiums. When shopping for plans, weigh the benefit of lower monthly payments against the potential risk of large out-of-pocket expenses in the case of a major illness or accident. If you are self-employed, you may be able to deduct up to 100% of health insurance premiums you pay out of pocket. High deductible health plans. Our increasingly popular type of health insurance is the high deductible health plans. These plans have higher deductibles and lower monthly premiums. Their users are the only ones eligible to open a health savings account that has substantial federal tax benefits. For 2023, the IRS defines a high deductible health plan as one that has deductibles of at least $1,500 for an individual or $33,000 for a family. Total out-of-pocket maximums are $7,500 for an individual and $15,000 for a family. For 2024, a higher deductible health plan is one that has deductibles of at least $1,600 for an individual or $3,100 for a family. Total out-of-pocket maximums are $8,050 for an individual and $16,100 for a family. Contributions are tax deductible. Contributions grow on a tax deferred basis. Qualified withdrawals for health care expenses are tax free. Important note, you can withdraw money from an HSA after age 65 for any reason with no tax penalty, but you will pay income tax on the withdrawal if the money is not used for qualified medical expenses. Federal health insurance plans. The Affordable Care Act, Medicare and CHIP. What is insurance and why do you need it? Health insurance is an agreement which is the insurance company agrees to pay for some of all of your medical expenses in exchange for a monthly premium payment. Who need health insurance? The simple answer is everyone. Health insurance offsets the cost of minor medical issues and major ones, including surgeries and treatment for life-threatening ailments and debilitating conditions. How do you get health insurance? If your employer offers health insurance as part of an employee benefits package, you will be covered, although you will be probably have to pay a portion of the cost. How much does health insurance cost? The cost of health insurance varies widely based on the scope of coverage, the type of plan you have, the deductible, and your age when you sign up. Co-pays and co-insurance also add to your expenses. You can get a good sense of the cost of plans by looking at the four levels of coverage offered by the Federal Health Insurance Marketplace. It categorized plans are bronze, silver, gold, or platinum, with each category priced according to the level of coverage provided and their corresponding cost to the user. The bottom line is, unlike many countries, the US does not have a universal government healthcare system. Instead, it has a complicated system of subsidies and tax incentives that make healthcare affordable for most people of the time. If you are employed, you probably have health insurance that is subsidized by your employer. If you are self-employed, you can get insurance directly from a private insurer. If your income is low, you can get subsidy for the cost. If you are elderly or disabled, you can get coverage through the federal Medicare or Medicaid programs. Trade on the go, anywhere, anytime. Terms and conditions are cost sharing reductions. Cost sharing reductions are type of federal subsidies distributed as discounts that help reduce out-of-pocket costs for healthcare expenses. Group health insurance, what is and how it is works and its benefits. Health insurance deductible, what is health insurance deductible and how it is works. And the next is health maintenance organization, and after that there is another point which is health insurance premium, and the last and next is pre-existing condition exclusion period definition and limits. The pre-existing condition exclusion period is a health insurance provision that limits benefits for a period of time for a prior medical condition. So friends, this was our today video about health insurance and health insurance definition and how health insurance works. So I hope all of you have received a good information and useful content by watching this video. So I request you kindly like, comment and share this video, and before to go, just remember to press the bell icon button and subscribe my YouTube channel Post Ads to get latest and fresh uploaded videos directly to you. So we will meet in our next video on our YouTube channel Post Ads. Take care, be safe, have a good day.